Hello, everyone. This is Megan Mescher-Cox. Thanks for joining us today. So today we're talking about fatty liver. So for those who are joining us for the first time, Jay Ziebart is also on here. Jay and I have put together the Disease Prevention and Reversal Summit, and this is our webinar series. Here's Jay hopping on to say hi. So let me pull up our presentation here. Today's topic is fatty liver disease. Other topics that we'll be having come up soon will be on insulin resistance and diabetes. Oh, here we go. And insulin resistance and diabetes, and then also on cancer in the coming months. Please, if there are any topics that you all specifically want to hear about, we want to know so we can make sure to put those on the schedule as well. Okay. Here we go. So the goal here is to share information about topics today, again, fatty liver disease, to share information and really what we can do to help recover or prevent fatty liver disease. Fatty liver disease is so very prevalent, as we'll go over nowadays, very prevalent, and very importantly, there's no pill, there's no simple, easy cure. It really does come to lifestyle change. It's what we eat, and it's how the composition of our body. Okay, so to start off with a couple questions, just to get all of us thinking and a little participation here. What the questions I have for us to start: what % of the population has fatty liver? You know, if you were to guess at what % as far as here in the United States. Do you have fatty liver? Do you know if you have fatty liver is really the question. Can you have fatty liver if you are normal weight? And is fatty liver reversible? We'll jump right in. What population of what % of the population has fatty liver? The answer is over 30%. So it's estimated to be over 100 million Americans that have fatty liver disease. Do you have fatty liver? Let's check it out. If you have some information from your doctors, or there might be some indicators that could tell you yourself if you have fatty liver. Yes, you can have fatty liver if you are normal weight. And often fatty liver is reversible, but not always. So first, let's start talking about the liver. The functions of the liver, and actually the first piece is, where is it located? So the liver is located on the right upper quadrant of your abdomen. So the picture of this body that we're looking at is as if we're looking at a person who's facing us. So right upper quadrant of your abdomen, kind of tucked in a little bit underneath the rib cage here. And it looks just like this. The liver has a wide range of functions. We don't need to go into all the details. We'll touch on some of those functions when we're talking about what we can see when the liver is not functioning properly. But your liver is amazing. It does a lot of work. The big things to mention, it does produce cholesterol and produces other proteins that your body needs. It filters the blood of toxins, including a lot that comes in via diet or via drink, and manages and regulates different hormones and clotting factors. So this picture, I love this picture to share with people, because it really gives an idea of what we're talking about when we say someone has fatty liver. So a healthy liver looks just like this. It's really nice and smooth on the surface, but it's a dark red in color and uniform. When we have fatty liver, it literally is that fat deposits in the liver. It can progress to further stages, but when we look at the liver, like an actual human liver, it looks like this, that we can actually see fat in the liver. So how do we diagnose fatty liver? Most commonly, primary doctors, I work as a primary doctor. Most commonly, a primary doctor will see an elevation of a liver enzyme or both liver enzymes, and that will be the first indicator that there's fatty liver. Often from there, we'll go and we'll do an ultrasound of the liver. So it's the picture on this side. Your doctor could also identify fatty liver on imaging. So if you get an ultrasound of your gallbladder, or say you get a CT of your abdomen, or often the chest as well, they'll see part of the liver and they can see from the imaging if there is fat in the liver. A newer test that's out, which is a really great test, it's called a FibroScan. An elastogram is also what it's called, but FibroScan is one of the brand names. And it actually tells us, it quantifies the stiffness of the liver, which changes depending on how much fat you have in the liver. So pretty much, if someone has a FibroScan, then they can be told, okay, you have less than 5% fat in your liver, which is normal, or you have X percent fat in your liver. And oftentimes we see it where there's over 65% fat in the liver. So the FibroScan, that will tell two different things. One is how much fat is in the liver. And the second is how much fibrosis or scar tissue has been formed in the liver. The fat portion is the one that is reversible. And once the scarring is there, that's the part that is unfortunately irreversible. So this graph, I put this in here so we can see the incidence of fatty liver. So the increase in incidence, okay? I call that out because that's different than prevalence. So this is the number of new diagnosis of fatty liver every year, okay? So when we look at the number of people that have it, of course, then it's more of a parabolic graph. But the diagnosis of fatty liver has been going up significantly, hugely because there's more, we see it more and we know to diagnose it. Hugely, of course, the change in the habits of the population as well. But the two of those together, that our habits have been changing and lagging behind that a bit, but now we have a diagnosis, a way to quantify it. So let's talk about the liver disease, the pathogenesis of fatty liver, because most people, when they hear fatty liver, they say, okay, great, then what, right? Do I lose? I know I need to lose weight. Oftentimes that's what people have been told by their physicians, but that takes some time. So what can we do now for that? So when we talk about what forms and what causes fatty liver, it really comes down to, actually, let me fast forward. I apologize, I'm missing a slide here. But the pathogenesis, the things that cause the fatty liver, it's too much. It's an excess of a number of things. One is excess of weight. One is excess of insulin, which we'll go into here. Too much insulin is the hallmark of type 2 diabetes. Too high of blood pressure, so that's high blood pressure. Too high of cholesterol, or too high triglycerides. These are often all tied back to dietary. So insulin resistance in particular. So we see the cycle here, okay? So someone eats a meal, then they have high sugar levels in the blood, sugar and fat. Excuse me, that causes the pancreas to push out a lot of insulin, okay? So to be really clear about the glucose we're talking about here, this is a very unhealthy meal, okay? Carbs are not all bad. So sometimes when I say sugar, people hear carbs, that's not one and the same. So let's suffice it to say, an unhealthy meal causes elevated levels of these unhealthy compounds in the blood. The pancreas shoots out insulin so your body can deal with the meal that has just come in. And there's so much insulin that your insulin receptors end up becoming very resistant to it, because the insulin receptors cannot keep responding very fast multiple times a day over years or decades and still do a good job at it. So then finally the receptors just say, okay, stop, we can't keep doing this. They stop responding. So then what happens is you have this high glucose level in your bloodstream. So the sugar level is high in your bloodstream, your insulin levels high in your bloodstream, and the cells are starving of what they need because that sugar cannot get into the cell where it's needed. Then the body responds by creating more hunger and cravings because the cells are needing the actual glucose in order to run. And then the cycle starts over again. So this is the cycle of insulin resistance. Insulin resistance causes that adipose tissue, that's a fancy way of saying fat cells, causes breakdown of fat cells, which cause more fat in the bloodstream and increases the amount of fat you have in your liver. The other mechanism is that this insulin resistance also causes this high insulin level and high sugar level in the blood, which causes your liver to make more fat, which causes more fatty acids in the liver, and that contributes to us seeing fatty liver. And then, of course, the dietary fat. So when we're getting more of the unhealthful fats in the diet, that goes straight to your liver, and fat accumulates in your liver. So we saw pictures before of the normal liver and fatty liver. I like this depiction because it actually shows the increase in size that we often see with fatty liver. When the fat is deposited in the liver, it causes the liver to stretch and get bigger. Normal liver cells, this is a depiction when we look under a microscope. So normal liver cells look like this with a special stain that we put on them. So what you can see here, all these little purple dots are the nuclei. So that's each individual purple dot is depicting as a liver cell. So these are all the liver cells. You can see they're nice and close together. And when we see fatty liver disease, we see these big white dots within the liver. Those big white dots are globules of fat. When we look at fat under the microscope, they show up as these white dots. So that's what we see in the early stages of the non-alcoholic fatty liver disease. The steatohepatosis is the NASH is what we call that. So non-alcoholic steatohepatosis, NASH, that's when we see the fibrosis or the scarring come along. And again, that scarring is depicted, if you can follow my cursor here, where you can see these strands going through the liver, which were not present before. Okay, so the stages of disease. Because if someone has gotten an ultrasound or a fibroscan, they want to know, okay, well, how bad is it, right? That's a question we often get, how bad is it? So these are the stages of liver disease. This is our nice healthy liver here. Hepatic steatosis or fatty liver looks here, where you can see the fat in it, but without scarring. This is still at the reversible stage. The steatohepatitis or a NASH, that's where we have some scarring that's coming up and a bunch of inflammatory factors. So the liver at that point is very inflamed. That is still the reversible stage when there's anger and inflammation in the liver. We still are able to reverse it until we get to a very significant amount of scarring that then we call cirrhosis. At this point, the damage is irreversible. This shows a similar picture, so we can skip over this. For some people that like these pictorials, this one shows a better picture, where it's really nice and uniform here in the healthy liver, and then the non-alcoholic fatty liver, that's where we start to see the fat accumulate. Then once we see the inflammation, that's the NASH. And then cirrhosis is where the cells have died and where there's significant scarring. So just to really get this in play, we'll skip over this because it's the same one. So I want to spend a moment to go over the sequelae of liver disease. This I want to share with you all because this is the type of thing that doctors see in training. And I really wish we had more of the opportunity to share with you how bad things can get as far as liver disease. Oftentimes I think there's this sense that it's not going to happen to me, or it can't be that bad. It's a little bit of fat in my liver. It's not so bad. We hear it quite often. And unfortunately, we have seen the suffering it causes for people. So I want to share some of these pictures. If you are squeamish, you might not appreciate a couple of them. Okay, so it's not awful, but I just want to warn you ahead of time. So this is a pictorial, but it tells us what we see in liver cirrhosis. So this is end-stage liver disease, that irreversible stage. So the liver's not functioning, so we can't clear toxins out of someone's body, okay? So what happens is blood builds up behind the liver when it's being filtered from all of the blood vessels in around your organs, your abdominal organs. So with the blood building up there, we see an enlarged stomach. That blood gets pushed out and we see this fluid, we call it ascites, but really it's like almost just like a clear light yellow fluid that builds up in the person's abdomen. Many liver patients, they describe it as feeling, looks like they're pregnant all the time, or they feel pregnant all the time. And that's very similar. And that's exactly a good description of it, because the stomach looks like the person is, as it looks when someone's carrying a baby. So the buildup behind, so the stomach has gotten enlarged. You see dilated blood vessels, again, because of the buildup of the blood behind the liver, since the liver can't filter and function as well. Muscle wasting, so with all the toxins and then without the liver being able to make the proteins that the body needs, we get muscle wasting. We can get encephalopathy, where that's just a fancy term for saying like really extreme confusion, delirium, and it can be so bad that people can be in comas with the buildup of ammonia in particular. There's changes in the hormone levels. So there's more estrogen and less testosterone. So there's not as much body hair, like males will notice their body hair has gone down. There's these spider veins that people describe, especially on the chest. That's from the increase in the estrogen level. Gentlemen in particular notice that their genitals get smaller. And jaundice, so a buildup of bilirubin, and part of that is some of that bilirubin can get deposited under the skin, making the skin or even the eyes a yellow color. It can also be very itchy, so people itch and feel very uncomfortable that way, and red palms. So these next pictures are the ones that if you're squeamish, you might not want to see. I wanted to show them because this is cirrhosis. So when we look at the liver, again, the pictures before, the liver looks really nice and smooth. And this is what a liver looks like when there's been irreversible damage to it. This is a picture of the ascites. So when there's buildup of fluid in the abdomen, and then the muscle wasting. So where the arms, all the extremities get much thinner with the lack of the muscle. So this probably looks like an odd picture to you all if you haven't seen these types of pictures before. We are looking at an esophagus, okay? So we're looking at an esophagus from the top, looking down into the person's stomach, okay? So these two balls that are depicted here, these are what we call esophageal varices. So the body has a way, we have blood vessels that go around the esophagus. And right at the bottom of the esophagus, there are larger blood vessels there. With the buildup of blood, since things can't move through the liver as well, the buildup of blood also affects the blood that runs to the esophagus. Because there's buildup there, those blood vessels, can get really enlarged and they can break open and they can bleed. And unfortunately, it can be a cause of death in someone with end-stage liver disease or with cirrhosis. It can be really, really severe. So it's one of those, we just have to watch very closely for any bleeding and make sure if there are varices, then we usually do screenings, like with the endoscopy, go down and take a look. If there are any of these balls here, then we try to band them off so that they can't bleed. And then what happens after the band is placed here, that means that the blood can't get out here. It ends up just dying off, and then this tissue will end up healing. If someone has varices, quite often we see that more and more varices are made over time, but it's a way to fend off any possible bleeding. And liver cancer. So again, a depiction of a liver and liver cancer can come, especially if there's cirrhosis. So the causes of disease. So we talked about this already. I'll skip through here. This is the slide I was looking for before. But the one thing I hadn't mentioned was poor diet. And really the key piece on the poor diet, it's a deficiency of healthful foods. So the main up here, high weight, high insulin, high blood pressure, high cholesterol, high triglycerides. Yes, those are diseases of excess that comes from excess fat and sugar and calories in our diet, but also deficiency of the healthy foods. It's both of those that cause the damage to the liver. If you all have ever seen me present, you've probably seen this slide. I think it's in every single presentation I do almost. This is the standard American diet. So on average, this is what Americans eat. So 63% of the diet being processed food. This is calories in the diet. So 63% of our calories coming from processed food, 25% from animal food, 6% from processed plant foods. So that's like ketchup, tomatoes in the form of ketchup. That's like potatoes in the form of French fries. And then 6% whole plant foods. So only 6% of the average American's diet is coming from whole plant foods. So this is one of the causes and probably the major cause of fatty liver disease. I put this picture in here because, finding good for us to look at a graph and say, ooh, we should eat less processed food and more plant food. But then there's the indolent, oh, let's have barbecue with grandma and grandpa, right? And the typical barbecue that happens in America is somewhat typically patties and hot dogs. So I put this in here to call out that this is a whole cultural shift, right? There's been this cultural shift to this diet that's very high in processed foods and animal products. And unfortunately, that cultural shift has taken a huge toll on our health and causing this huge upswing in fatty liver disease. So that's also part of the solution. So the major piece is how to prevent it, how to treat it. And if we know we have fatty liver, how do we reverse out of that fatty liver? It can be done. Once the scarring's occurred, we can't remove the scarring, but even if there's scarring there, putting things into place so we can reverse the cause of damage can help prevent it from progressing to full-blown cirrhosis. So this is another one that's probably in every presentation, but this is a food pyramid. This is Dr. Furman's food pyramid. There are multiple that look very similar. This is my favorite because it really shows vegetables on the bottom. Vegetables being the base of our food intake. They're really low in calories, right? So we need to make sure we're getting lots and lots of vegetables in order to get all these great nutrients, but without the calories. So vegetables as the main source, then fruits, beans and lentils, whole grains and potatoes, nuts, seeds, and avocados, and then sparingly eggs, oil, fish, and then the processed food and treats and junk food on the very top there. Okay, so as you all know, with lifestyle medicine, we talk a lot. Lifestyle is 80% of the solution. Medications and supplements when needed, surgery when really, really needed, but that's used most rarely. Most of our treatment is always lifestyle. With fatty liver disease, there are no medications or supplements that are recommended for it. There's no medication on the market. They're doing a lot of different trials right now, but there's nothing available. And then surgery is, unfortunately, some people do need liver transplants when it gets that far, but there's no surgery or medications for curing or reversing it. The treatment really is lifestyle. So this I stole from Kaiser, so I need to make sure to give them proper credit for this, but it was just so perfect. It was a great depiction of the plant-based plate. So across the board, health systems and physicians are recognizing, okay, we've got to start from the plate, from what's going in, if we really want to make any progress and really help people reverse out of this, to prevent it, to treat it. So great depiction, because half of this plate is non-starchy vegetables. So half the plate non-starchy vegetables, a quarter of the plate with the plant-based protein. Beans are an absolutely fantastic source, high in fiber, high in protein. Lentils, tofu, and I tell my patients peas fall in here as well, because they qualify as far as high in fiber, high in protein. And then 1/4 of the plate with starchy vegetables or whole grains. So any of these, if you can see this small type, quinoa, bulgur, corn, barley, farro, amaranth. Some of these, honestly, I had never heard of until I started doing lifestyle medicine and really learning about this. So if you haven't heard of them before, they're great things to try. Okay, unhealthy weight. So if we change our diet, our weight goes right along with it. Going to more of the plant-based diets, that will lower the weight as well, so long as we're not getting in a bunch of added oils that are sneaking in there. Saying no to alcohol. So if anyone has fatty liver, absolutely, it's recommended to not have any alcohol. Some people will ask, well, what if I have some, a little here, a little there? Definitely, it's a personal choice, but for the liver's already suffering, it's not recommended to have any alcohol. Coffee is known to be helpful. So 2 cups a day or more can help with detoxifying the liver. And then again, that changing culture. So really huge, instead of the patties here, changing it up. So we're really starting to create and teach the younger generation things that they can enjoy, but that won't come at a cost to them. So foods they can enjoy, and that won't that will hopefully start turning around this epidemic of fatty liver disease. I wanted to go over a nutrition label with you all. So this real world advice. So this is what it comes to, and I go through with patients when we're in the exam rooms. Of course, it's difficult with time, but it's so important that we really need to walk through to get to the nitty gritty. Jay actually is amazing at this. This is what she does. So I probably should hand it over to her. But one in particular, so people will get really excited about plant-based diets. We hear it all the time. Okay, doc, I went plant-based, but I'm not seeing progress. And it's very frustrating for them. So this is an Impossible Burger. And then the next, we're going to go over a plant-based burger. And then the very best is a homemade plant-based burger. When I first thought of making homemade plant-based burgers, I thought people were crazy. Like, who does that when they're a mom and works full time? It's really not that difficult once you start to learn to do it. I always tell people I'm about like 5 ingredients. If it's more than that, that's too many for a cook like me. And there's a ton you can do even with that. So let's walk through a nutrition label. So again, this is an Impossible Burger, excuse me. So when we look at the nutrition label, we want to look at fat, specifically saturated fat or trans fats. So saturated fat is high. Your body needs 0, like never needs to ingest saturated fat. Any amount of saturated fat that you ingest will lead to more plaque buildup, will lead to more fatty liver. So we look here. We also look over at the fibers and the added sugars. Okay, so yes, the Impossible Burger is plant-based, but it's very high in saturated fat. It's high in sodium as well. So those are like 2 huge knocks against it. Okay, well, maybe we're being hard on it. Let's look at the ingredients. Water, soy protein concentrate, coconut oil, sunflower oil, natural flavors. It's usually a good rule of thumb to look at the top 5 ingredients. So the first ingredient will be the one that's in the most of. So this is mainly made of water. Excuse me, the one that has the most of is water. Okay, thanks. Sorry, Pete. Thanks for being here with me. I have a sick girl right now, so she just came to say hi to us. So water is the number 1. Soy protein concentrate. So I want to talk to you all about the soy protein concentrate. If soy is very healthful for our bodies, whole soy products are associated with lower chronic disease, less cancer, less dementia. It's very healthful. The soy isolates or concentrates are not. Those are also associated with chronic disease, just like the animal products. Coconut oil is the next. I always tell patients, yes, coconut is a plant-based food. It is not a health food. It's almost pure saturated fat. So please do not have coconut oil thinking that we're doing something good for our liver. It does not help the liver, it damages it. Okay, and then the next is Dr. Prager. So best if we can make our homemade burgers where we know exactly what's in it and we're not adding a lot of extra oil. But if we can't, what do, right? So this is one I show patients because if we walk through the same thing, the fat, especially that saturated fat, fiber and added sugars, okay? So there is some fat in here. There's 0.5 grams of it is saturated. There's 4 grams of dietary fiber. You'll notice there is some sodium in this one as well. And there's no added sugar. Then if we look down at the ingredients are things that we know to be whole plant foods, right? Carrots, onions, string beans, oat bran, soybeans, zucchini, and then this expeller pressed coconut canola oil, peas, broccoli, corn. So you see, it's a much different ingredient list than that Impossible Burger. So that is what I have. I wanted to make sure to keep some time for questions, and I see some up here.
I'm here with you.
Okay.
So I realized that you all probably couldn't see me as Dr. Cox was talking, and I was just nodding my head because that's exactly what we want to look for in those labels, and we want to watch out for those things that have gotten popular. Anytime something is popular, we should be a little nervous. And what I'm talking about specifically is coconut oil. It had a little bit of a glow up a while back, but it is not healthy for our bodies. Way too much saturated fat, and it is a highly processed food, just like all other oils. So we have some great questions and comments in here. Let me go ahead and get us started. So you had mentioned something about supplements. Now there are a lot of supplements out there, teas and herbs and all sorts of things that claim to be able to heal our liver. So what I'm hearing from your presentation is that's not true.
That's not true. Thank you. Thank you for bringing it up, Jay. Yeah, there's a lot of things on the market. Please save your money. It's not going to help the liver. Natural dietary fiber will help the liver. And that's what we see in vegetables, fruits, beans, lentils, peas, and whole grains, and nuts and seeds.
Right. Okay, excellent. Very, very good. Now, the other thing you did mention a couple of times, but it might be a good idea just to make sure that we're clear on this. Even people that do not drink any alcohol, they can be diagnosed with fatty liver. They can get fatty liver just from what they eat, correct?
Yes, thanks. I didn't mention that, and I should have. So in general, a lot of times we think of we think of liver disease, and even as I was taught in medical school, excuse me, liver disease, the main ones were alcoholic liver disease or liver disease from hepatitis B or hepatitis C. Now, fatty liver is by far and away the most common. Then alcoholic liver disease, hepatitis B and hepatitis C also do damage to the liver. We definitely never want to combine those toxins. So, if there's already fatty liver disease from food, we don't want to add in alcohol as well and worsen the damage or the stress on the liver.
Absolutely. So we have a question from Brian here. I lost 30 pounds and don't feel the cramping in the liver area. Is it getting better?
That's awesome, Brian. Congrats. So yes, I can't say 100% that that's what's having it get better, but we do see that quite often. So especially if there's cramping in that right upper quadrant or anywhere in the top part of the abdomen, it can be because the liver is not getting stretched as much from that fat that's being deposited in the liver. The liver comes in a capsule. It's almost like a balloon stretched over it. That capsule has a ton of nerves on it. So when the liver is stretched from fatty liver disease, some people feel that a lot more than others, and it can be really uncomfortable. Excuse me.
Got a tickle. So that actually leads me to another question I wanted to ask, and that is about symptoms, because you called this fatty liver the silent epidemic for a reason, right?
Yes, thank you. So most of the time people do not have symptoms. It's found incidentally on blood tests or the imaging studies, but sometimes it is where someone's having like a pain or cramping pain, and that leads us to do the imaging.
Okay, I'm just going to give a couple of props here while she clears that tickle out of her throat. I have been there. It's so frustrating to be in the middle of a presentation and your throat will not cooperate. So let's just point out Jen saying, yay, that looks like the plate from Dr. Sean Hashmi at Kaiser. So a personal shout out to Dr. Sean Hashmi. Definitely heard that name before. So doing good work over there at Kaiser. Grill marks on those veggies, she said. Okay, so thanks, Jen. Judith asks, when a person has a liver transplant, I've heard that only a portion of the liver can be used. How is this possible? That's an interesting one.
Yes, so it's true. A liver transplant, they don't transplant the whole liver, it's a portion. And the liver is great, and the liver can outlive the rest of the body quite often. But this new stressor of the standard American diet is something that oftentimes, unfortunately, is too much of a stress on the liver, and in the whole liver then suffers. But yes, it is true that if we're not stressing the liver chronically, then people can live with just a portion of that liver.
Excellent, excellent. So Jason had a question about the coffee. What about decaf? Does that count towards the protective?
Oh, that's a good question. So yes, it is. So decaf is okay. One thing to note then, when you make coffee, to make sure to use a filter, or some people even recommend 2 filters. But usually I'd recommend to patients at least just use 1 filter, because we want to make sure some of those oils don't get in there and just get the actual coffee. You might not have ever noticed, but there's some oil then that's involved with the coffee.
Great. Excellent. Monica, can you get fatty liver from long-term medications?
That's a good question. So there are certain medications that are hard on the liver, that can be degraded. Most medications are degraded by the liver or by the kidneys. They go through two functions, but most of them are by the liver. So some are especially hard on the liver, and those ones can cause some damage. So it's considered another toxin to that liver, depending on what the medication is. So absolutely not every medication. I want to make sure that's really, really clear. But some medications, yes, can be hard on the liver. Those medications are usually ones that are monitored with blood work by the prescribing physician to make sure that we're watching for liver damage. Notice I see a question here. Would tea be helpful if you can't stand coffee? So tea can be very helpful because of the properties of tea being really full in antioxidants. So yes, absolutely, tea can be helpful. I should really group that in when we're talking about, my standard vegetables, fruits, tea falls in there. Certain teas in particular, green tea is especially great for the antioxidants.
Yes, that's a beautiful thing to mention because, we're talking about something specific here today, but when it comes to holistic health, green tea is one of the most fantastic things that you can include as part of your daily routine. And people tend to have fewer issues than those select few that have trouble with the coffee, either because of stomach issues or because of sensitivity to caffeine, what have you. So green tea is an excellent option for those folks too. Barbara asks, if you have varices, does that mean you're in the cirrhosis stage?
That's a really good question. So that means we're in the stage where esophageal varices are one of the signs of medical terminology. We say decompensated liver disease or a complication of liver disease. So it means that there's some portion that's scarred. It usually, typically means there's cirrhosis, although we're also seeing some now in that NASH stage where there's some scarring, but it's not full cirrhosis. So if there's esophageal varices, sometimes there's a good amount that can still be reversed. It depends on that person's individual liver, but it's not always only full-blown cirrhosis. Sometimes it's like that stage 3 from those pictorials that we see it on.
Very interesting stuff. Very interesting. So I'm going to just acknowledge this last comment in the chat, and then I'm going to pop over to the Q&A questions. So we haven't forgot about you over there. I'll be right over. So just want to say, have a fellow health educator on the call with us today. Hello, Sister Suzanne Soppy. She said, thank you for the excellent presentation, which helped increase my knowledge. Pictorial were very helpful and simple to understand. Thank you, and good to see your faces. So love to have you on, sister. So good to see your name on here. Okay, great. So Debbie, go ahead. Debbie has a question and requesting a clarification, which is a really good clarification. So we'll get to that in just a second. Her question is, having had hepatitis caused by food 35 years ago, could it cause fatty liver, which could be reversed?
That's so great. I'm glad you asked this, Debbie. So the hepatitis, the type of hepatitis that we get from food, is a foodborne illness, is hepatitis A. Most of the time people can get oftentimes people can get a pretty severe response when they first ingest that food and have that reaction, and they do not have long-term sequelae. So no, it does not cause long-term liver damage. Except for the few that go into full liver failure at that acute phase. So if someone has gotten over hepatitis A, if they have fatty liver in their later years, the fatty liver is likely because they have fatty liver from either food source or is there alcohol, is there something else? It's not from the hepatitis A. So excellent. Say too, I did not put in the presentation today. It's a missing to not put it. There are different genetic factors, and we're learning more and more, but there are different genetic factors that make people more susceptible to getting non-alcoholic fatty liver disease. So it doesn't always make someone go that way, but it can give them a propensity. So for instance, if you see families where sometimes we'll see families where there's multiple people affected with really severe NASH or cirrhosis, it's really hard to tease out what percent is diet when everyone's typically eating the same food and what percent is the genetics. They're finding more and more that there are some genetic syndromes, but please don't blame the genetics per se. Usually what I'll tell patients, if they do have a genetic propensity, all the more reason for us to be really quite aggressive to avoid extra stressors on that liver.
100%. So this is the clarification, and I think this is a good one to reiterate about soy, because there's so much confusion about soy. Can you please repeat which is better, which soy protein choice is better?
Oh yes, okay. So whole soy is good. So that is edamame. That's actual soybeans. Like tofu is considered a whole soy food because that's really just the soybeans with a little bit of binder stuck together in blocks. Tempeh is a whole soy food, and soy milk. Please choose the unsweetened so you don't get all the added sugar, but those are the whole soy foods. So anything that says soy protein isolates, soy protein powders, Jay, you probably know some of the other ones, but anything that doesn't just flat out say soybeans or soy is the isolate and not a good choice.
Absolutely. When you're looking at those ingredients, we don't want anything that's been heavily modified. Soy is just a bean. That's all it is. It's just a bean. I know some people are real scared of it, but it's just a bean. And so if it says on your, let's say you're choosing your milk, if it says anything besides soybean and water, choose something else, right? We want the most whole and the most clean ingredients in there. And tofu, tempeh, and soy milk are considered part of a whole food plant-based diet. So if you just remember those three and just get rid of the rest of it as much as possible. Okay, Jack asks about coconut oil. Since coconut liquefies on the skin, doesn't it stay liquid in your body?
Okay. That's so does it stay liquid in your body?
Here's the thing. When we use this solid at room temperature indicator for a poor choice of fat, this is just a simple visual cue for folks to try and choose something better. There are a lot of oils that are at room temperature that are still not good for you, but those ones that are more solid at room temperature, it's because of the way that those molecules are stacking together. And so when they're solid at room temperature, that just gives you an indication. It's not really about the melting that's the issue. It is about what that fat is. What is it compared to the rest?
Thanks. I think that's a great explanation of it. Because what the saturated fat is what like drills in and causes those plaques in the walls of the arteries. Same with a bunch of added sugar and high insulin levels. So for instance, sugar too, that one's hard on the body. It's liquid in the body while it's in the body. But yeah,
right. Yeah. It's just an indicator to give us a clue to try and make it easy to make our best choices. Monica asked, can you develop fatty liver from, oh, we answered that question already. Thank you, Monica. All right, Pat asks, it was shared that homemade burgers are the best with under 5 ingredients. Can you share some of those recipes?
Yes, we should. You know what, Jay, how about we put some up on the website?
We definitely will. That's a great idea.
Yeah.
Yes, and at the very end here, we're going to share some resources for you, including the website that Dr. Cox and I created specifically for disease prevention and reversal. So we'll be sharing that with you at the end. Okay. Thanks, Pat. And
started to talk about symptoms. Yes. So yes, I did touch on symptoms. What would they be? So symptoms of fatty liver So like if someone has fatty liver, may know it, might not know it. The symptoms, quite often it can lead to some fatigue, or that like upper right quadrant, like kind of aching pain. But fatigue is, that one's a hard one to tease out. At least I think it is for patients, because if there's fatty liver disease, there's typically not an ideal diet. There's other factors that are going in that can also cause fatigue. So, Mayo Clinic and other places, they write fatigue as a symptom of fatty liver disease. But I don't know if we can flat out say it's from the liver disease, or if it's just from the whole picture.
I have to tell you, my energy went through the roof after I transitioned to a plant-based diet. So what we eat on a daily basis, the way that we fuel our body, is definitely going to impact our energy. Monica asks, are almond or oat milk as good for you as soy milk?
That's a good question. So whole plant milks are great. I usually recommend soy for patients instead of almond. Very honestly, and I want to hear Jay's answer too. Honestly, because of the water that goes into the almond milk, just the almond trees take a ton of water. So it's a little hard on the environment. Oat milk, actually, I usually will not recommend as highly, same as rice milk, because there are some concerns with the amount of arsenic in it if those oats or rice are grown in the United States. So what would you say, Jay?
Well, I would agree with you in terms of the almonds. One thing to realize is that when it comes to animal products, plant products don't come anywhere near the water usage, but almonds are one of the worst ones when it comes to plants. And so if you're concerned about the environment and water usage, all of us here in California, maybe that's one you want to avoid. The other thing is it's really hard to find almond milk that is just almonds. And so most of them have emulsifiers and, gums and all sorts of crazy stuff in them. I have found some, so if you're interested in almond milk, let me know. The only thing I do like about almond milk is that it's very light, and some people like that. So if you do choose almond milk, just make sure it's just almonds. If you can't find that, reach out, I'll help you out. The other thing about oat milks or rice milks or anything, it's about what you're getting out of them, right? So are you getting, when you remove the fiber from things like grains, then you're losing some of that protective fiber that helps to get rid of those excess contaminants that you're not going to be able to get rid of as readily without it, if that makes sense. So we want to try and include that fiber as much as possible. Again, looking for really nice, clean ingredients. I do also prefer soy. It just depends on the person whether that's the one I definitely recommend. Soy is a little bit higher in protein. It's a little bit higher in good fats and other things. Again, just soybeans on that ingredient list. Okay, Jack asked, what foods cause hepatitis?
That's a good question. So for the viral hepatitis, so my apologies, because I kind of skipped over that a little bit because we didn't go into everything. So technically hepatitis is, if we break it down what it means, anytime we put itis at the end, it just means inflammation of. So inflammation of the liver, hepato is liver, inflammation of the liver. So it's not a very good habit, but in the medical community, when we talk hepatitis, typically we're talking about viral hepatitis. The most common viral hepatitis are A, B, and C. Hepatitis B and C are bloodborne. That comes from needles, that can pass from mother-child, that type of thing. Hepatitis A is the foodborne one. That comes when any food is contaminated with feces. So there's not much hepatitis A in the United States. Other countries have much more, but oftentimes like unpeeled or unwashed fruits, or quite often if people would travel to certain countries, it will be recommended to get immunized against hepatitis A if there's a lot of contamination in the water supply or just in general in those countries.
Very good. Jason asks, what's your opinion on having proteins at the same time as eating fruits?
Okay, I'll let Jay answer this one because I know she talks a bit about this with people.
Yeah, so there have been a lot of articles and people's opinions out there about food combining, combining different kinds of foods, whether you need to, whether you shouldn't, and all that kind of thing. I just want you to trust your body. Your body knows what it needs, how much of this, how much of that, and if you're eating the foods in whole food form, your body knows what it needs, so it'll retain what it needs until it gets those complementary ingredients at some point throughout the day. So on both ends of that spectrum, don't worry about eating foods together and don't worry about eating foods separately. Your body is smart enough to be able to get what it needs and, get rid of the excess as long as we're feeding it real food.
That's good. And I usually always tell people, because we get a lot of questions, with intermittent fasting or, food combining, that type of thing. But let's not worry so much about the timing. It's all about the quality of the food. If someone wants 1 meal a day it is. If someone wants 6 meals a day, have 6 meals a day. But make sure it's like good quality, whole plant-based foods.
Absolutely. And, one of the things that we run up against is that, two people eating a plant-based diet can be eating very, very different things. So make sure your diet is balanced, make sure it includes all those colors, make sure it includes a variety of foods and that you're not eliminating anything like all the carbs or all the fat or all the anything. Like it should be a nice, lovely balance. And if you're looking for specifics on that, just reach out. We're always talking about that. So anytime you need help. Oh, looks like I have another one in Q&A here. You're welcome. You're welcome. Okay, good stuff. Now, we have just 2 more minutes. We really used up our time today. This was an excellent topic. Thank you, Dr. Cox. It was fantastic. I do want to talk about a couple of things before we sign off for today. Number one, Dr. Cox and I share her patient of my client who reversed her stage 3 fatty liver disease down to stage 0. And we are just so proud of her in just a few months. So depending on how much damage has been done, your body wants to heal. Just give it what it needs in order to do so. It really wants to, trust me. And it feels really, really good when you're able to, heal some of the damage that's been done. And it doesn't just feel good because you did it. It feels good in your body too. The other thing I wanted to share was our resources. So I'm just going to pop in the chat here for everyone to see all of the things that we do around here, and I'll explain them all. Oops, I lost it. I'll be right back with you.
And we'll make sure to honor your time. Usually we're like right on the dot, we'll sign off. So if we go over a few minutes, please don't feel like you have to stay. We'll want to explain it a little bit. But thank you all so much for joining us. We loved having you here. And we'll put up some recipes along with some other resources there on our site.
So yes, thank you. Thank you for that. And thank you for coming. If you do need to go, we really appreciated you being here with us today. So the first here on the list is our website that we share, Disease Prevention Reversal. That's prevdoc.com, prevdoc.com. Remember, we have a webinar like this the first Wednesday of every month at noon, and they're always free. We're going to be having a really cool one next month. Keep an eye on that website. If you get the newsletter already, you'll already be on the list to get an invitation. Dr. Megan Mescher-Cox has her own website, www.meganmeschercox.com. And on there, she has information about Walk with the Doc. You want to tell us a little bit about Walk with the Doc?
I'll say we can get the information on there. So it's the first Saturday of every month. So it's this Saturday, even 9:00. If you all have any questions or want some information, want to learn a little bit and have some socialization and be beautiful at the beach there, come on out. I should also say I won't be there this Saturday, but we have a great doctor covering. Dr. Wood, he's also a lifestyle medicine doctor. So he'll be able to answer your questions too.
Yes, he's great. It's going to be fantastic. So the next thing I wanted to share from my site, Plant Based for Life, we do a free support education plant chat every Saturday at 11 a.m. Go ahead and visit my website and get signed up for my newsletter, and I'll make sure you get an invitation for that. All right, we're just getting, thank you, fantastic presentation, really good, a lot of thank yous, thank you, thank you. Thank you all for being here. This was so much fun, and do reach out if either of us can help. We're always looking to help people when they are ready to make some changes.
Okay, have a wonderful month. Hopefully we'll see you back next month, first Wednesday at noon. Take care.
See you all soon. Have a great rest of your day.